Welcome to FellCare Connect's orientation. Just want to make sure you have before we start our orientation, I want to make sure you have your username and password that you should have received in your welcome letter, along with a bunch of attachments that we're going to go along in this orientation. So if you haven't done so, please pause me and go ahead and print out all the forms you need for the orientation in that welcome letter. Okay, so let's proceed. I'm Randy Pillard, the CEO of FellCare Connects, and we are a family-owned and operated therapy company. Here's my family. This is me, the CEO. This is Sam, the CFO. He's my husband. This is Shachar. He's the COO in charge of operations and all of our systems. And this is Gal, who's in charge of marketing and expansion throughout the United States. These are my children. Our mission is to be an advocate for the patient, help you as a clinician with your needs, and to provide a quality service to the home health agencies we serve. The benefits of working with FellCare Connects: since we work with so many agencies, we are able to funnel referrals to our clinicians all from one place. We have an extensive healthcare administrative team to support you out in the field. In essence, we are your support team. The reason why we're doing this orientation is to provide an overview of our company, the clinical documentation system we use, and the who's who of our organization. Providing you with this information will help you determine who to contact in order to get your needs met. Your role: providing patient care, ensuring that patient needs are met by increasing the patient's functional ability to the goals set in the evaluation, and ensuring that notes are submitted to FellCare Connects in a timely fashion and done correctly, which ensures that everyone gets paid on time. We're now going on to the who's who. This will be an overview of our entire support team, who you can reach out to if you have any questions. So now let's go to the who's who's list. In this orientation video, I have a template of what you have in what we've emailed you, which actually has the names of the contacts of the people you will be reaching out to. So please make sure you note that on the contact information. So on the first page of the who's who's list is our address, our phone number. The address, please note, is when you need to mail in paper daily route sheets or any documentation that's been signed by you and the patient on paper. Our main number is the 818-926-9057. It really is an important number. You can always reach out and text people through our text messaging systems or through people's cell, but the best way to contact our group is through the main number, the 818-926-9057. So as we go through the list, let me just take a couple of minutes to introduce you to our team. We have HR, who's responsible for hiring, compliance, credentialing, as well as our front desk. Marketing and sales. Expansion is responsible for building and maintaining the relationship we have with thousands of home health agencies throughout the United States. If you want to pass along information about a new agency you think we should be working with, please contact our Director of Marketing. Our finance team is responsible for payroll questions as such. If you have any questions regarding how to submit your invoice, when to submit your invoice, who to submit your invoice, please reach out to our payroll division. And finally, our service department, of which you are a part, is overseen by our Director of Patient Care. Within our service department, we have our intake team, processes all admissions documents. Our assigning team is there to ensure that our patients are being seen within 48 hours. If there are any difficulties in achieving this goal, the assigning team will reach out to you to see if you are running into any problems and provide assistance. This team will be texting you through the Tiger Text app, asking you to see if you can see patients. You should be able to, if you could, you should be able to respond as quickly as possible in order for us to get back to the agency so we could accept these patients for you. Our scheduling team will help you schedule the first visit. if you're having any problems. This department also ensures that the initial documentation is in the chart. As you know, we are Medicare compliant, and as such, we have 48 hours to see the patient once you've accepted the patient. Care coordination will help you with all your questions regarding care coordination, including questions about insurance, authorizations, frequency and duration, and relaying messages back to the home health agency. Most importantly, the services department includes you in your role as a clinician. You are an integral part of this division, providing the skilled patient care to improve the lives of our patients. Overseeing all of our services, our quality assurance department reviews all clinical notes, and you can speak with them if you have any questions about documentation. Let's go on to the next form that I emailed you in the welcome letter, which is your home health visit cheat sheet. This is a guide of how to proceed through your home health initial request of accepting the patient to actually seeing your patient and submitting your documentation. So if you haven't already taken a moment to read the steps, please do so. Just a couple of minor important things that I do want to I want to go over. The things that you want to make sure you do in your visit, of course, is to have your daily route sheet signed, whether electronically or on paper. It is proof of that visit being done. If it is on paper, you do need to mail that in weekly with all the visits that you've done for that week. You want to make sure you record your vitals in the patient handbook as well as in your documentation. Please note, if your vitals are outside of normal parameters, which is listed in your policies and procedures, you definitely want to take a moment, call our main number, 818-926-9057, and please give that information to our front desk, who will then call the home health agency and talk to the nurse for you. If the patient is asymptomatic, of course, you want to document that on your communication note physician's order at the end of when you're documenting in the evening or later on during the day. If your patient vitals are outside of normal parameters and they are symptomatic, then, and if you feel like they do need to go to ER, please don't hesitate, call 911 and call us as well, of course, or call the doctor to give them that information. So please, in your own free time, go over the visit cheat sheet. It is a guide, and hopefully it will be helpful towards you. Now let's proceed to the overview of company and timely submission of paperwork, policies, and procedures. So for this, you can definitely keep it alongside as we go through the actual orientation on the documentation process, which is in Devero. So take a minute, log on to Devero, which is wellcareconnects.devero.com. Again, you'll have access to your username and password in that welcome email that we sent you. So I'll give you a minute to all log on. Great. So now we've all logged on to Devero, and as you can see, this is the interface that we will be using to do our documentation when or after we see our patient. This is a web-based system, so if you have a iPad or smartphone that you feel that you can document on, please do so, but it does have to have cellular, it does have to have internet access. For all of our disciplines, obviously, you'll note that this interface does pertain to PT, but OT and speech are very similar, broken down in the same format. Obviously, for OT and speech, the documentation will be a little bit different, but it is the exact same format. So let me just go over the orientation of Devero, so you'll know where to go and what to look for. But up in the right-hand side is your name, and you can always change your personal password or username in your profile. As you can see, to the left of that is Messages, which is a HIPAA-compliant instant messaging app, which you can also download on your phone. It will be mandatory that all text messaging will be done through Tiger Text, since it is HIPAA compliant. Up at the top section is where you can actually access your patients that you've accepted and assigned. And here, as you can see, you can click on the drop-down menu, and the patients that have been assigned to you will be here. In order to access and open up any of the forms below, you do have to select a patient. But the forms below are the section right below your patients is for starting the forms for a patient. We have packets, clinical forms, shared forms, resources, paper, PDF, policies and procedures, state-specific forms. Under reports, we have analytics, PT customer reports, clinicians reports, which is a clinician's invoice report here. So again, when you're submitting your invoice, you can actually generate your invoice directly from Devero. Further down the homepage, we have folders that you can access your forms that you've already submitted, you've started, need to be signed for your assistance if you're using any, or pending forms that you might have started and haven't completed, as well as shared forms. Let's just go over some of the sections on the main page. Once you go ahead and select a patient, so we're going to click on the drop-down menu, go ahead and select Training Sample, okay? Once you select Training Sample, you can then click on Patient Profile, which is just an overview of the demographics of the patient. Address, phone number, diagnoses, the referring agency, as well as the doctor information and insurance information as well. Going back to the home page, we can then access the patient chart. Go ahead and click on that, please. Once you click on that, you'll actually have contents of documentation. This is a training sample, of course, so you'll have documentation of completed samples of the team. So if there's PT, OT, and speech all on the case, everyone documenting in the chart, well, all the notes will be populated into that chart. So you'll actually be able to review everyone's notes. In your case, what we have here on the left-hand side is information being pulled over from the patient profile. So easy access to the address, phone number, doctor's information, and everyone else on the team, as well as the type of insurance that the patient has. So if it's private insurance, it's going to indicate how many visits we might initially have under policy number. If it's Medicare, then you know that you have 60 days certification to work with that patient. Please note, you must call the office after you do your evaluation to give your frequency and duration. If it's a private patient, if you only have one visit, you cannot proceed until you have further authorization to see your patient. If it is a Medicare patient, please continue to proceed to see your patient based on your frequency and duration, and check in with your care coordinator by the second week just to confirm that your plan of care is approved by the nurse and the doctor. Again, the phone number to reach the agency is 818-926-9057. In the center of the chart is, again, the culmination of all the notes that have been done by all disciplines. In your case, there are actual samples for each discipline. So for PT, OT, and speech, you can click on your specific document that says PT or OT and speech and review how a form is actually supposed to be completed. Again, these are samples and suggestions on what we require. So just for this purpose here, go ahead and click on PT Communication Note Physician's Order. Is a sample of a PT communication note, which just includes why you're seeing the patient, what the patient needs. If the parameters are outside of normal parameters, you are going to be documenting that, and also as well as any DME equipment that is needed. Down at the bottom, underneath the physician's order, you want to include your frequency and duration along with your treatment diagnoses. You can refer to see your plan of care to summarize that, but you do have to reference your treatment diagnoses underneath the physician's order along with any DME equipment that is needed that goes along with your plan of care and your goals that you've set for your patient. And so for PT, OT, and speech, there is a sample for each one of you. Just real quick, for an OT, it's a little bit more narrative. Both PT and OT, they are correct. Either one goes. You can be a little bit more descriptive if you need to. If not, then you could be more succinct. So going further down the chart, just so you have access to know that you can review the different sections, we have the physician's order, we have the clinical notes, which includes our interoffice communication note. It's strictly an administrative tool to log what's going on with the patient in the office. The care coordination note is a team conference, and it's only required for our assessment. Our daily route sheets, which are electronic. This is, again, for every single visit, your patient must sign one visit, one daily route sheet. You have your plan of care, which is our 485, all the goals. If there's PT, OT, and speech on the case, all the goals will populate into that plan of care, and you can open up the plan of care to review it. You're not going to be doing anything actually in that form. Then if you move further down the chart, you have your physical therapy notes, you have your occupational therapy notes, and you have your speech therapy notes, as well as registered dietitian. So again, if you have any questions on those, please take time outside of this orientation to review these samples. They are very helpful. They really do explain how to fill out the forms. Go back to the home page. Now, mind you, you cannot click on your back button. It will kick you out of the system. So right above the patient sample or your name of your patient, there is the home link that you can click on to get back to your main menu. Right below forms, we have packets and clinical forms. What we've done here for all PT, OT, and speech, for each of you, we've created packets, and in the packets present each of the actual types of visits that might occur on any visit during home health. So this is the occupational therapy interface. As you can see, it's the exact same layout. You have your messengers on the right-hand side. You want to go ahead and click on the drop-down menu to select your patient. Under packets and clinical forms will be slightly different documentation requirements and different packets that you'll be accessing. If you're going to do an evaluation, you would click on the evaluation packet, and all the forms are bundled into that packet, which is very convenient because that way you don't have to remember what forms you need. It's all there. So what is required for all PT, OT, and speech is a care coordination note, a daily route sheet, your communication note physician's order, your evaluation and plan of care, and some sort of assessment tool. It doesn't have to be the one that's in the packet. It could be one that of your choosing, but then of course you would document that in your evaluation. Go back up to the left and click on Home. Back to the main menu. When your frequency and duration, once you've done your evaluation and your frequency and duration is approved, if it's, again, private insurance and you only have one visit, then you have to stop and wait for authorization. So you want to follow up with your care coordinator to make sure you're approved to go back. If it is Medicare, please continue seeing your patient. Just check in again the second week to confirm that your plan of care has been approved. So now you're going to go back for your follow-up visit. So all you have to do, click on follow-up packet, and the forms that are needed for your visit are all there. So you have your daily route sheet and you have your therapy visit note. In the packets could only be used one time in any one 60-day certification period or 60-day episode period. So when you go back for your third and fourth and fifth follow-up visits, you will be going under the clinical forms, opening up your daily route sheet, and opening up your therapy visit note. For your OT discharge summary packet, the forms that are required when you're discharging your patient are right in the discharge summary packet. All these forms do need to be completed. when you're completing your occupational communication note physician's order, all you need to state in the top summary section that your patient is being discharged from occupational therapy. You do not have to give a reason why, because you've already stated that in your OT discharge transfer summary. The additional package you have for an occupational therapist is your OT functional reassessment packet. This is required for all disciplines, OT, PT, and speech. In Medicare, every 30 days we are required to do a 30-day functional reassessment. So if we're still seeing the patient within that 30-day window, the system will automatically prompt you to do a 30-day functional reassessment. This is in place of a visit note. So you'll click on the packet, and the forms that are required for this visit are all in here. I just want to make one note. When you are doing a functional reassessment, if the patient is meeting their goals, everything is fine. You do not have to complete a communication note physician's order. But if the goals are not being met and the patient actually needs more visit, please indicate that on the form and then complete the communication note and physician's order requesting more visits. Again, you have to check in with your care coordinator to make sure that the visits are authorized. Your OT discharge OASIS packet, again, your NOM-NOC visit. Your NOM-NOC visit is required for your second to last visit, and it's a notice of Medicare non-coverage. So if your patient is a Medicare patient, we just have to have them sign this. You can either print it out if you do not have cellular reception, or you can open it up on your smartphone to have your patient sign it. You also have your OT discharge OASIS packet. Again, all the forms that are needed for your OASIS discharge are right here. So the OASIS discharge, if you're doing that, that means the PT has discharged the patient, the nurse has discharged the patient, maybe the speech as well, and you're the last remaining discipline on the case. As such, you're the one that's doing the OASIS. There are additional packets in the packet section. If there's a non-visit meeting, you weren't able to get to see your patient for your last visit, and we're supposed to do an OASIS discharge, then there's your non-visit OASIS discharge packet, which includes your OASIS discharge non-visit and your OT communication note physician's order, as well as if it's a OT discharge summary packet non-visit, you would just click here as well to access the forms. Again, we do see some pediatrics, so if you are seeing some peds, you can actually open up the forms that are required for that pediatric case as well. Under clinical forms are all the forms individually accessible for each of the type of visits that you will be doing as well. Another form that we have to talk about is the missed visit form. It is a requirement. If you've missed a visit in that week that you were going to see your patient, so for example, if your frequency is 1 week 1, 2 week 3, and the second week you've only gotten one visit in to see your patient, you have to put a missed visit in and document why you missed that visit, whether the patient was sick or had an MD appointment or something else occurred. You have to document it. We also have to submit a physician's order to address the plan of care. So if we said that we're going to see the patient 1 week 1, 2 week 3, the second week was missed, and we didn't meet the plan of care, such as we didn't see the patient, so the goals were not met, we have to write a physician's order to make up that visit that was missed and include the treatment diagnoses or the plan of care and the goals that you are going to work on to address that missed visit. If you need any more information, please refer to the Who's Who's list to find the right person to contact. One of the other things that I did want to note, when you see your patients, you want to make sure that for every visit, there's a daily route sheet signed. So just to do a quick overview of how to get that done, you can either do it electronically or you can do a paper daily route sheet. For an electronic version, which is really nice since once you sign and the patient signs, it's embedded into the chart and you don't need to upload anything into the chart, and then you don't need to mail your weekly, daily route sheets to the office because it's all electronic. So go ahead and under clinical forms for this exercise, click on Daily Route Sheet, and your form will have the name of your agency, Daily Route Sheet. On the right, you'll click on the field to choose your time. Just go ahead and click 4 o'clock. For this exercise, go ahead and click 5 o'clock. And then over to the left, I don't use codes, so you're going to type out the action of the type of visit you did. So it's going to either be evaluation, regular visit, or discharge visit, or it could be a DC Oasis, or it could be a start of care, just for an example. So you're going to type out evaluation. Your units are going to either be 3 or 4. Each unit equals 15 minutes. We cannot document anything less than 45 minutes. You want to select your discipline, so PT, OT, speech. Then for the patient to sign, you click to sign right where it says patient signature. The box opens. The same mechanics actually operates on any type of smartphone, but again, you must have reception since this is a web-based system. So you can take your stylus or your finger or your mouse pad and actually sign your name. The patient will be signing their name. And down here, down at the bottom, you accept signature or clear or cancel. In this case, we're going to accept the signature. And as you can see, the name populates into the signature pad and reduces back into the daily route sheet. Now, in order for you as the clinician to sign, your name is going to appear where it says caregiver signature. So you're going to click on send to office, and then you're going to go ahead and put your ID and your password into the authorized signature wizard. And click authorize, and that's a completed daily route sheet. If you're doing a paper daily route sheet, because there is no reception, you want to go ahead and print out 5 or 10 of these and put them in your medical bag, just in case you have no reception. So once you print it out, similarly to the electronic, you want to date the visit, the patient's name, the patient's signature. If the patient cannot sign, it's okay. You can use a friend, caregiver, someone else can sign for the patient if they're not able to. Time in and time out. Again, I do not use any kind of code, so you're just going to write out the type of visit that's here. Units, either 3 or 4 or 5, you get paid for a session. We can't document anything less than 3 units, which equals 45 minutes. Don't worry about the MR number. The home health agency will fill that out. Go ahead and circle your discipline, write your name, and sign your name. And then go ahead and just check off the corresponding visit code down at the bottom of the page. So every single visit requires one daily route sheet. So for a paper daily route sheet, before you mail those into the office, you want to go ahead and scan that paper daily route sheet on your computer, or you can actually take a text, you can take a picture of that on your camera and email it to yourself. Either way, you want to upload that daily route sheet into the actual patient chart. So go into the patient chart. So you've already scanned your paper daily route sheet onto your computer, and up to the right where it says upload documents, you want to click on that button, and you'll be able to select the section that you want to upload that document in. For daily route sheets, you want to scroll down, go to the section of your daily route sheets, click right here, and then browse on your computer for the daily route sheet for that patient. Choose it and then save. And then it will populate into the daily route sheet section in your patient's chart. We're now going on to how to complete a clinician's invoice report. Go ahead and click in here. I can't show you an output because we don't have any samples we don't have enough samples to generate an invoice report, but you can go ahead and click in the invoice report, and you have filters. You'll go ahead and select the month. So for this example, go ahead and select from December 1st to December 31st. You want to have your patients on Select a Patient. The forms are all selected, so you don't touch that drop-down menu. You don't touch the agency drop-down menu. For your chart statuses, you want to make sure that all your chart statuses are selected. And then for your form statuses, you want to go ahead and make sure that your sent to office and completed forms are selected. In addition to that, you want to go ahead and under Mark as Filter, select Not Non-Bill, which means bill, and then hit Go. Once you hit Go, all of the visits that you've done for that month will populate in the center of this page. You'll then go ahead to the right, click on Export to Excel, and download the clinician's invoice report. All the visits that you've done for your patients will actually be in this spreadsheet. Go ahead and verify your payroll rates that were all completed in your independent contractor agreement. Total that, and then save it and email that directly to payroll@feldcareconnects.com. Again, if you have any questions, you can reach out to our main office, 818-926-9057, and ask to speak to our finance department. And lastly, I want to go over the payroll schedule. You want to submit your invoice the first week of the month to payroll@Feldcare Connects. You'll receive a response that your invoice was received from one of our team from that department. We pay once a month. As you can see from our schedule, we publish this each year. So this is a generic one. The one that you received in your email will actually have the dates corrected for that particular month and year. So if you have any questions about payroll, you can certainly reach out to our payroll team as such. If you do want direct deposit, please with your HR documents that you're sending to HR@feldcareconnects.com, you want to go ahead and send a voided check to HR@feldcareconnects.com so you can have direct deposit. You don't have to if you don't want it. Then you will receive a paper check in the mail at the end of the month. Thank you so much for being part of our team. I really appreciate your help. And if you have any questions or need further clarification, please feel free to reach out to us.